Everybody. I'm Shelby Castile, a licensed marriage and family therapist and founder of OC Shrinks. The OC Shrinks was officially created as an online space for mental health professionals in Orange County to connect and find referrals, and it's grown into so much more. And we're here today to put on a focused depression recovery program, and it's going to be hosted by Rogers Behavioral Health. We are excited to have Danielle Olson run this for us. Danielle's been with Rogers Behavioral Health since 2013, and since then she's gained experience working with various populations and at various levels of care. And currently Danielle is working as a behavioral specialist, as well as working on her doctorate as a practicum student, working in all programs and levels of care offered at Rogers in San Diego. So welcome.
Thank you, Shelby, and thank you everyone for attending. I'm very excited to give a little bit more insight into the programming that we offer here at Rogers San Diego, and really just give more insight into different modalities that could also be applied at the other levels of care, outpatient, if decided to, learn more about BA or behavioral activation for short. So I will share my screen. All right. So as Shelby said, we are going to be talking about behavioral activation for depression today. And as we go into that a little bit, I'll just kind of review our agenda. So talking a little bit about Rogers programming structure that we have at our San Diego campus, and then getting into what behavioral activation or BA is, as well as why it's effective, and then various ways that we implement it in and outside of programming. And then of course, leaving time for questions as well. To give a little bit of insight, at our San Diego location, we offer 2 levels of care. And the first is our partial hospitalization or PHP, and that is offered 5 days a week for 6 hours per day. And then we have intensive outpatient care, which is again 5 days per week for 3 hours per day. So with that intensive outpatient level, we're expecting patients to be a little bit more independent and really practicing and gearing up for transitioning to strictly meeting with their outpatient therapist outside of Rogers. And currently within these 2 programs, we are treating adolescents as well as adults. And within our programming, we're primarily engaging in treatment from the cognitive behavioral therapy lens. And within that, we are engaging in behavioral activation, also implementing DBT-informed practices. So being able to gain insight into mindfulness strategies, working on emotion regulation, distress tolerance, and working on improving relationships as well. And then if appropriate or clinically indicated for our patients, we also introduce exposure response prevention or ERP, which helps address a patient's struggles with anxiety-related disorders or kind of different themes that may be coming up for them. Okay. And a little bit more about our programs. So throughout our programming, we have, of course, structured daily schedules. And with that, that is having a really great balance between group time as well as independent work time. So within our groups, as I mentioned before, we have cognitive behavioral therapy, and then we also have dialectical behavioral therapy informed groups, process groups, and mindfulness. And in that setting, our patients are getting to interact with their peers and really see these different activities and things in action, right? Learning from each other, and really that normalization occurs, that they are not alone, that others are struggling as well, and really having that cohesive unit. And then while they're not in their group time, they are engaging in structured activities. So behavioral activation activities, which I'll get into in just a minute, exposures as indicated. And then we also highly encourage, and of course at the adolescent level, requiring the family support sessions. So really allowing the entire family unit or support unit to really make the changes that are going to help our patients succeed. And then of course, one-on-one therapy sessions as well. And one amazing thing that I really love about Rogers is that we get to work on a multi-D team, right? So everyone's amazing perspectives are coming together, and just that collaboration for the patients are essential. So with that, we are able to, of course, consult one another and make sure that we really have a great treatment plan moving forward with them. And those meetings with the individuals on the team are happening weekly. And then also, in my position with the behavior specialist, we're meeting with the patient daily and multiple times daily. So we're really kind of that lifeline to assist with behavioral activation and exposures if needed. And then also making sure that we're communicating well with the rest of the treatment team to ensure that we're providing the best care for our patients. All right, so we'll get into the meat and potatoes now. So several years ago when I started at Rogers, I was really unaware of what behavioral activation was. And oftentimes people engage in BA and they don't even really know it, which is kind of cool. So we can use that as examples to kind of get their buy-in into treatment. So if individuals could really change their mood, right? If they could snap their fingers and do that, they would, right? That doesn't happen in a consistent manner. So with BA, we really look at the idea that our mood and our behaviors are tightly linked. And with that, we are an empirically supported treatment that we use here. And we continue on with that. We closely monitor outcomes or the data that our patients provide us through weekly assessments, looking at their depression rates, looking at their quality of life. So we do that from an overall perspective of programming to make sure that we're remaining effective, as well as on that individual basis as well. So if there is a spike in someone's, weekly scores for depression or something like that, we're able to look into that, note triggers, and if needing, offering more support and altering treatment plans. But with that, oftentimes patients may struggle with wanting to ruminate or engaging in rumination. So getting very stuck on painful feelings of the past or things that they cannot change, right? And oftentimes with individuals who are depressed, this continuously happens and actually makes them more depressed. They feel if they are processing an event that happened, they wonder, why am I feeling worse? Why am I not feeling better? That's where BA comes into play. We have the process piece with their therapist, as well as taking this outside in approach. So we're focusing on the present with behavioral activation. Yes, we're noting important events that may have come up in the past that are impacting our mood now, but really we're examining current behaviors and looking at a trajectory of where the patient would like to be. So currently I am struggling to maybe go to work, balance my duties at home, and then we will look at various areas of their life and really kind of map out that plan for them of how we're going to get them there. So one part of doing that is really creating awareness with our patients. And the first thing that we do is introduce what we call the TRAP model. So essentially, you're getting stuck in the trap of depression. And I know this might look like a lot, and it's something that can be used as a very useful tool for patients and their families to really kind of understand what is occurring with our behavior and our mood. So the first area, or the T, that we're going to look at stands for triggers. So with that, this can be any type of negative life event for that individual. Okay? And some examples I have up here, of course, struggling with relationships, with family, coworkers, friends, peers, any type of maybe negative feedback in a setting such as school or work, any type of loss that could be a family pet, a family member, divorce, right, and relationship ending. Okay, so these are just a few triggers, but there could also be other more major triggers that could come up as well. But from that trigger, the individual then, of course, has an emotional response. That is our R in the TRAP. So from that could be an array of feelings, right? And oftentimes our patients will not understand that they can feel more than one emotion at once. And that's where the DBT skills come in, right? Two opposite things or two different things can occur at the same time. So I can feel very depressed, and also maybe a little excited that I get to talk to a friend on the phone tonight or something of that nature. So really helping them understand the array of emotions that they experience, even moment to moment and day to day, can be really helpful. So this piece, their emotional response, usually takes a little bit of practice for them to really learn about what their maybe physical cues are to tell them a little bit more about how they're feeling. Maybe if they're feeling a little bit more tired, that might indicate more depression versus, say, a rapid heart rate and their temperature going up could be more overwhelmed or stressed. So from those points, we have that trigger, we're noting our responses, and because we are feeling those emotional responses, we don't want to have to deal with those feelings that are coming up. So then the AP of our TRAP occurs. So the individual engages in avoidance patterns. Okay, so this may look like not eating regularly, not sleeping or sleeping too much. It could also look like coping with substance use or self-harm, withdrawing from others, isolating. So all of these things are occurring, which in the moment feels as though it's addressing dealing with the emotions or the trigger, when in all reality, it's kind of digging us deeper and getting really stuck in that trap. So what will happen after a while? We are engaging in the avoidance patterns, which of course doesn't address our trigger, it doesn't address our emotions, and then another trigger comes up. We are unsure of how to cope with it, and the entire cycle will start again. So this cycle will continue to kind of keep our patients really trapped in their emotional experience and what's occurring for them on a daily basis. So how do we fix that? How do we get through this? As I said, that first piece is the awareness piece, okay? And then how we start to flip that is by introducing what we call the TRAC model. Okay, so we have a silly saying that the adolescents really like it. So we're gonna get out of the trap and get back on track. Okay, so kind of that little cue to let them know, okay, I need to think back to my trigger, my emotional response, and am I avoiding right now? Or are we getting back on the track and actively coping? Okay, so with that, active coping might look like asking for help, right? Expressing to someone how you're feeling. That could be a friend, it could be someone on your treatment team, family member, engaging in problem solving, right? And sometimes that can be a little tricky too, because we might look at the whole picture versus what steps we can take in that moment, okay? And to assist with some of those, bigger picture issues, we'll also encourage active coping skills, such as distress tolerance skills, also maybe active outlets or, physical activity to get some of that energy out, cope with some of those emotions, bring their intensity down a little bit, and then we can move forward with increasing that communication or working on problem solving. And when those things are happening, it can be any step to address the trigger and what's happening. Because of course we know we can't change the trigger. Okay? Our emotions may still be strong, but with that active coping over time, that's going to decrease the intensity of what is coming up for our patients, and they know how to respond appropriately and keep themselves on track. And oftentimes as well, we create little, what we call TRAC cards for the patient. They will have specific triggers for them, their specific emotional responses, and then skills that work best for them in those moments. So if they are struggling, they can pull that card out of their backpack or purse or pocket just for that friendly reminder of what they can do in that moment. Okay, so awareness is increasing. And then what do we do next? So we really want to look at, of course, now what we call the core of behavioral activation treatment. Because when individuals are depressed, they are not what we call activated, right? They're not engaging in their life to the fullest as they would like to be, okay? They are avoiding, isolating, and really at a loss of what to do. So how we help them is we will initially start to introduce activity scheduling and monitoring. So activity is a very big kind of blanket term for anything that they would need to do in their lives. Okay, so whether it is making their bed, brushing their teeth, eating, calling a friend, really anything that we can break down for them is kind of known as an activity. So when we have them start to kind of keep track of this for us, we want to know what they're doing in their day. Because our patient might say, I'm doing absolutely nothing, I'm laying in bed. Okay, so we have that established. What other things are you doing or not doing? So maybe they're spending a very long time on devices throughout the day and kind of distracting themselves trying to get through the day. Are they watching hours of TV, kind of binge watching Netflix, those kinds of things? Or are they able to every once in a while, take their dog for a walk, eat dinner with family, those kinds of things. So this helps us really kind of track and get that baseline of where they are in that current moment. How is their functioning? And then what we have them do is we will have them track their mood related to these activities. Because like I said before, with BA, it is an outside-in approach. So in a gradual manner, we will have them engage in these activities. And after engagement, we'll have them rate their mood. So before and after. So for example, if I am getting up in the morning and I really don't want to brush my teeth, I will rate my depression in that moment. And I will also rate how difficult I think that activity will be. And for many other places outside of Rogers, they may use a 0 to 10 difficulty scale or, any type of pain management scale, rating scale. We use 0 to 7. So with that, 0 meaning I would have no depression. This activity is not difficult at all the way gradually up to that 7 where I am maybe absolutely more depressed than I've ever felt. I cannot get out of bed. And this activity for me, I can't even think about it because I just want to pull the blanket over my head and kind of sleep for the day. So with that, I'm getting ready to brush my teeth and I might say my depression is a 4 out of 7. I brush my teeth and notice after a few minutes, I'm feeling a little bit better. Okay, maybe my depression's now after that activity, a 2 out of 7. So we're looking at this link, okay? How are these activities affecting our mood, okay? And noting that these activities are very intentional, they are planned out, okay? We have them very scheduled for them, again, because of their activity scheduling. And these different activities are giving them that pep in their step back, okay? They're noticing increased levels of energy and willingness to engage in more things. So, and I have, of course, various examples of activity scheduling, sheets and things like that. And the PowerPoint was just it was a little too much. So I decided to take those out. So if anyone would like an example of those, please just let me know and I can get that for you. And after really working on getting kind of this baseline down, we're going to then explore the 3 primary categories of BA with the patient. And in doing so, the activities will be made from these 3 categories. Okay, so the first one that we are going to talk about is routine. Okay, so of course, the first thing that kind of goes when an individual is feeling depressed is their routine. Okay, getting up at the same time, going to bed at the same time. Are we eating, scheduled meals throughout the day? Are we remembering to drink our water? Are we brushing our teeth, showering, cleaning our home, taking care of our children? Really making sure that those foundational things in our life are getting done. Okay. So what happens is, again, we'll kind of assess that baseline and see where the patient is. Okay. And they may only be regularly brushing their teeth 1 to 2 times a week. Okay. So with that, we then create a checklist with these different activities that they are going to do every day specific to these. And of course, over time, we're going to increase that to their desired level of functioning, which for most people, depending, right, is 2 times a day. So it's that gradual process. We're meeting them where they're at. And this is kind of viewed as the scaffolding of where we want to get with treatment. And then the next thing that we like to explore are pleasant or enjoyable activities. Okay, so with this, we're going to really focus on activities they may currently enjoy. And I will admit, this is difficult to find activities that are not technologically based for a lot of people right now because, everyone is at home, social distancing, all of those things. And we might hear a lot of kind of moans and groans initially about picking up a book or throwing a Frisbee with a friend, right? Or doing some of those other activities. And over time, it's amazing how many individuals have reported, an increase in their overall mood and lifestyle by simply not avoiding and distracting with devices. So really in that moment, that willingness and that collaboration with the patient is huge, and really getting them to try new activities or kind of revisit activities that they've liked in the past is really important as well. And these, of course, are just a few examples of enjoyable activities. We have had many individuals start to explore styling hair or makeup, or writing a book or singing or instruments, lots of different things that they maybe would have not tried because of their depression. So similarly, as I just explained with the routine activities, we will again be very intentional with these types of activities. So that may look like going for a walk twice a week for 10 minutes. Each time they're going for that walk, they'll give us that report back on how that walk affected their mood. And of course, over time, increasing until we get to that desired level for that activity. And we'll wrap up our 3 prongs of BA, if you will, our 3 categories with values. And as we know, we want all of our treatment to be client-driven and values-based for them. So with this category of BA, this is often the most difficult for patients to explore and also the most valuable for them. Okay, so we have our routine as that structure. The enjoyables kind of get them going a little bit, but the values portion is often where we see a lot of those strong emotions come back up. So we will, of course, complete a values assessment with the individual and kind of figure out what type of person that they want to be. What kind of goals do they have set, right? So if a value for someone is education and they want to take a couple classes for something, and yet they just are so overwhelmed with other things going on, how can we get them there, right? Creating those goals and those behavioral activation activities to maybe the first thing that we're going to do is explore different kind of majors or areas of study that we would want to do. After we're feeling great about that, then we're going to maybe move on to reaching out to different programs and schools, working on an application for 15 minutes a day until it's done. So every step is that gradual piece, helping them feel confident, building on that self-efficacy, and really moving them forward. And with that as well, one piece that can be difficult is looking at where they currently are. Okay, so oftentimes that, very pessimistic perspective might fall in there because they're not living the life that they want. So for us at Rogers, really engaging in, compassionate listening and validation and letting them know that, we're here and we're going to help them work towards where they would like to be. Okay, so then again, how do we get all of this going? Because it sounds like a lot, and if not seeing it in action, it can seem really overwhelming. So from the 3 areas that I talked about, the routine, the enjoyable, and the values, we create something called a hierarchy. Okay, so essentially, it is a big list of activities that we're going to have them work on that fit into those categories. Okay, so with that, we again rate them from easiest to hardest, and that's kind of like our treatment map. Okay, so that, at least from the behavioral specialist position, is what I'm assisting them in working on, while their therapist is also working on the family work or support work, as well as processing kind of anything else that comes up. So with this, over time, they are seeing increased mood, increased coping, really that ability to branch out and enjoy life again. So as all of this is happening, they will have their daily scheduled activities that they are doing. And one thing that also is very helpful is that follow through by the provider. So me checking in to make sure are these activities occurring as we scheduled them, as we agreed upon? And if not, looking at those barriers, maybe that activity is a little bit too difficult for the patient right now, and we might need to scale it back a little bit. Okay, so one huge portion of this is then practice and homework. Okay, so throughout the day, as I said, our patients will engage in individual work time as well. So during that work time, I may be supporting them in looking up those college classes, looking up volunteer opportunities, right? And all of that is, of course, for a purposeful, intentional, really set time. So we might do that for 20 minutes together, and then they will work on something independently as well. So it's really helping them kind of gain their footing and then realize that they can engage in these activities despite how they may feel in that moment, or despite what, situation may come up that may be difficult to deal with. And within programming, of course, we want them to really kind of work on generalizing these different activities, right? Maybe they can really work hard and follow through with BAs during programming hours, and then outside of programming hours, it's a little bit more difficult. We know that there are many more distractions at home, or other things on the outside of treatment that can really maybe affect how someone is feeling. So really planning for their evenings and making sure that they have that solid structure and schedule is important. So just really seeing the patients be able to go on, dates with their significant other again, or, working for a job promotion, or, joining a new yoga group or something. All of those different outlets and the things that are important to them are just so rewarding to see them work towards and to see them, really improve with. So, yeah, and along with BA as well, the patients really noticing that this can be effective for them, and then also kind of teaching it to their families, right? So encouraging their families to engage in BAs with them is another big part that we encourage as well. Because again, the whole family or the whole unit potentially, right, is working on making these active changes, not just the individual that's struggling.